Over the weekend, the CDC approved the COVID-19 vaccine for children under the age of 5, with millions of toddlers eligible to get the shot as soon as this week. But what does that rollout look like right here in the state of Florida? 10 Tampa Bay's Chris Rogers joins us in the studio to break it down.
Yeah, Carolina, since this announcement was made, the timeline here in Florida has been unclear. Why? Because the state chose not to pre-order the vaccine, but that doesn't stop hospitals and pharmacies from ordering doses themselves. And providers I spoke with say they're hoping to get shots in arms as soon as this week.
With 12 yeses and 0 no's, and the motion passes as stands.
After CDC approval, kids as young as 6 months old can now get vaccinated. Now the big question in Florida is when.
As of right now, it's still, we're waiting to hear when our order is being shipped to us.
Johns Hopkins All Children's Hospital say once the order arrives, they'll start giving out shots.
And we'll be ready to roll within the next day of getting the vaccine. We've done all the prep work.
Initially, there was some concern about supply after Florida decided to opt out of pre-ordering the vaccine.
This is a continuation of our policy that we've had in place really since the spring.
But so far, Johns Hopkins Children's says they're on track for a quick rollout.
If we get the vaccine this week, I don't see where it had a major impact.
The story seems to be the same with other providers as well. CVS is accepting appointments as early as Tuesday. Walgreens will offer appointments starting Saturday. And Bay Area locations are showing plenty of openings. Hospitals hoping to soon follow suit.
Leverage your own pediatrician to see what their availability is and what resources. And I'm hopeful in the next couple of days we'd have a pretty good list of who's got the vaccine at what ages, and we could start spreading that out for our families.
Parents can choose one of two options, a 3-dose series from Pfizer or a 2-dose series from Moderna. But the numbers show many parents aren't choosing either one.
We're seeing numbers of only 1 in 5 parents in this age group are interested in the vaccine.
Despite the hesitancy, providers say they'll be ready to go once they've got the supply. Now, it's important to note the certain pharmacies are only vaccinating specific age ranges. Walgreens tells us they're offering the shot to kids over the age of 3. For CVS, it's 18 months and older. We also reached out to Baycare Health to see when they plan to give out the vaccine at their locations. So far, we haven't heard back. We will keep you updated on our website. That's 10tampabay.com.
Let's take a deeper dive into why experts say kids in this age group should get the vaccine. More than 440 children under the age of 5 have died from COVID-19. Epidemiologists point out that's more than any other vaccine-preventable disease. The kids in this young age group also had the highest rate of hospitalizations, with 1 in 4 ending up in the ICU. And while your child or your grandchild might have had COVID already, there's evidence that more than 30% fail to have antibodies after infection, so they won't have natural immunity should they be exposed again in the future.